Recognizing that gender equality is key to eradicating AIDS, tuberculosis, and malaria, the Global Fund, in collaboration with GSK and Viv Healthcare, created the Gender Equality Fund. This initiative supports programs that focus on empowering women and girls, addressing gender-based violence, and improving access to vital services for those most affected by these epidemics. In line with this, the African Network of Adolescent and Young Persons Development, in collaboration with the National Agency for the Control of AIDS, NACA, and supported by Y+ Global, organized a one-day Inception meeting with national stakeholders in Abuja. Partners present at the meeting included the representative of the Honorable Minister of Youth Development in Nigeria, the Director General, National Agency for the Control of AIDS, NACA, the Executive Director, Y+ Global, representative from the United States President Emergency Plan for AIDS Relief, PEPFAR, UNAIDS, amongst other stakeholders. Welcoming remarks was delivered by the Executive Director, African Network of Adolescent and Young Persons Development.
Gender Equality Fund is a new phase of program for adolescents and young people in their diversity, especially our adolescent girls and young women. And as Nigeria, it is really a pleasure for us to be part and parcel of this new initiative. And we thank our partners, Y+ Global, who led the consortium, and also to Global Fund, Viv, GSK, who also availed the resources. As a country, it is my pleasure to see how, as we are in our diverse institution, we drive this as a multi-stakeholder approach towards seeing how are our adolescent girls and young women accessing, whether it's HIV, whether it's TB, whether it's malaria, services in an integrated manner and in a gender-sensitive, transformative, and affirmative way, and also how are we amplifying their voices to speak up in decision and policy level. So I want to sincerely thank you, and I use this moment to express my gratitude to the National Agency for the Control of AIDS in Nigeria, who also availed us this opportunity to work together to see how this can be driven.
Goodwill messages were delivered by stakeholders.
About 7.3 million adolescent girls and women are facing challenges that are going to be addressed today. And the fact that these biases and stereotypes exist, a forum like this is something that she's deeply passionate about. And the ministry is also working on initiatives that could support the advancement of young women and young girls. And for the partners as well here, if there's anything in terms of engagement, we're happy to have the conversation and see how well we can support. I'd like to thank the organizers for creating space on the agenda for this address, and I look forward to a fruitful deliberation. Thank you very much.
According to the Global Gender Gap Index for 2024 rankings, Nigeria ranks 125 out of 146 countries on the Gender Gap Index. That is startling, it's unjustifiable, and as a country, we need to do better. Without addressing gender inequalities, we cannot meet global commitments to empower women and girls, to ensure that everyone has their right to enjoy a very safe and healthy life. And we are looking forward that the GEF will also contribute its quota towards achieving this. UNAIDS remains steadfast in its commitment to support partners, the government, other CSOs, the GEF Fund, to ensure that we create a country where the rights of all persons are respected, protected, and ultimately fulfilled. We can and must close the gaps, including through addressing the intersection of gender inequalities and health. Together, we can create a nation where everyone, regardless of gender, can achieve their potential, can live free of violence, can enjoy a gender equitable and gender equal country.
We see this as an opportunity for us to foster collaboration and foster and promote respect where no one is left behind, where we are all valued and respected. So let's join hands, let's break the norms, all these gender norms that we hear and that saddens our hearts. Let's join hands, and we see this as an opportunity to do that. Let's break all the barriers that need to be broken so that young people can have access to equitable health in Nigeria.
There were also goodwill messages from the Representative Institute of Human Virology, IHVN, Society for Family Health, SFH, National TB and Leprosy Control Program, Network of People Living with HIV and AIDS in Nigeria, NEPWAN, Association of Women Living with HIV and AIDS in Nigeria, ASHWAN, and the National Tuberculosis Network. Declaring the meeting open, the Director General of the National Agency for the Control of AIDS, NACA, delivered the keynote address.
It is indeed a great pleasure and privilege to be here, and particularly, at a time like this where youth across the nation, are doing great things. Particularly our girl child, you see lots of females in position of leadership now, and we are very inspired, by the great things they're doing. So the arrival of this fund and the inception of this meeting actually coincides with that. And also, we're also very happy that at a time like this, when we're talking about prevention of mother-to-child transmission and saying that no child should be born HIV positive, we believe that this Gender Equity Fund will help to also propagate that message and also bridge that gap. So NACA as an agency, we are actually in full support of this, and we are very ready to cooperate with you. I know many of my technical team are already on board, working with you to make sure that these funds are judiciously used and we are able to actualize our goals and to ensure that HIV is no longer a public health threat by the year 2030.
There were presentation sessions including an overview of the Gender Equality Fund delivered by the Executive Director Y+ Global.
Gender Equality Fund has been designed by communities themselves, and it is going to work with communities to actually deliver it, to advocate and influence for gender-transformative and gender-affirming approaches to health. So I think a lot of times we've been hearing a lot about gender-transformative approaches, and we have seen in these documents and in theory, but I think it's high time we put it into practice at the end of the day. So we might need to step back, especially Gender Equality Fund. We're gonna start to say, okay, how do we even define what is gender-sensitive programs? How do we mainstream it at the end of the day? So those are some of the things that Gender Equality Fund is going to be bringing on board. So in these 3 years, VV Healthcare and JSK, which are pharma, and I think we all know them, they're called the private sector, they've decided that let's invest in Gender Equality Fund. Hence, they've invested around 7.5 million for Gender Equality Fund. Essentially, what they are supporting community-based organizations that are women-led or age-wide-led to engage, especially have leadership for them to be able to engage at key decision-making platforms. These are national, but we'll also bring it to regional and to global. Secondly, they are supporting what we call advocacy and accountability activities so that we can influence the relevant laws that are in these countries, policies, programs, and budgeting, because it's important. Let's talk about domestic financing. What exactly are we doing as communities to push so that our governments can then commit to HIV, TB, and malaria? Once these big donors, whom we love so much, move out of our countries, what exactly is going to happen to the communities affected and infected by HIV, TB, and malaria? That's the big question. So hence, we need to push in terms of advocacy and hold our governments accountable in terms of what they need to deliver to the communities. So those are some of the things that we're going to be tackling under Gender Equality Fund. We are also going to invest in organizational capacity strengthening. This is important and very crucial because remember, we are going to invest in community-based organizations, and some of them really don't have the robust kind of internal systems that are in place that enables them to even have bigger funding. So what we are saying is with Gender Equality Fund, we are investing in these organizations so that even if we leave, there is sustainability. Now they have their policies in place, they have their strategic plans in place, they can even now apply for other funding, whether in country, whether international funding. We need to enable them, we need to empower them to stand on their own. Hence, this fund is what is going to be investing in.
GEF Consortium presentation delivered by partners and many more. There was also a plenary session titled, The Role of Multi-Sectoral Approach in the Advancement and Sustainability of the Gender Equality Fund Beyond Global Fund Resources. Some stakeholders shed more light on the GEF and its implementations.
The Gender Equality Fund, in a nutshell, is to help us address the gender-related barriers in access to health services. And what we have seen is that science has given us solution to end the epidemics of HIV, TB, and malaria. But because of inequalities, we are still not yet there. So we believe that if we address the gender-related inequalities and human rights, then we are able to actually end these diseases as epidemics by 2030. And in terms of sustainability, I think the issue around gender is behavior change. So if we are able, through this fund, to change as much behavior, our cultural norms, and those masculine behaviors that give one gender an upper hand than the other. If we are able to change the behavior of people, then I'm sure that will be sustained and that we will not need to invest so much in future. But what we need to do is to invest now, or it will be too expensive to invest in future.
This is a new initiative that Global Fund is supporting across different countries, which Nigeria is also eligible. And through our partners, Y Plus Global, who led the consortium, we are privileged to be among the country commencing this project. So this fund in Nigeria, of course, will work with different multi-stakeholders and as well as other community-led adolescent girls and young women organizations towards seeing how they can drive advocacy effort towards shaping policies, and also ensuring that they are well positioned strategically across decision-making platforms so that they are able to amplify their voices. So that beyond the lifespan of Gender Equality Fund, other stakeholders or other donors can be able to confidently work with them, ensuring issues around gender norms, socio-cultural issues are all tackled collectively in a way that it does not affect access to services or access to opportunities for adolescent girls and young women in their diversity. As such, looking at this intervention or project or initiative as first in Nigeria at the moment, it's of importance that the government of Nigeria and also at the state level, the government take positive action in ensuring the sustainability.
Lawyers Alert is a human rights-based organization, and we work with women. Our focus group are women, adolescent girls, and other vulnerable persons. We include persons living with HIV, persons affected by TB. So the sustainability of this project, aside and outside the Global Fund grants, means that it is part of our mandate. It's in our strategic plan even before the Global Fund came on board. So of course, it's just like a continuation of what we've been doing. A key component of our work under GEF is to strengthen capacity of those women and young girls to demand for accountability. So once their capacity is strengthened, of course, even outside the project, they will still engage. So at the end of the day, this project is aimed at the communities themselves, and they will take charge of the project.
For us as National TB Program and Leprosy Control Program, we are trying to empower the community entities to be able to be on their own, generate funds on their own, and also to create more advocacy through the government systems for issues that relate to gender and related barriers. Also to support them to make sure that from the level of legislative arm, they are able to actually make some legislative commitment to be able to support issues relating to gender and gender support. So it's very key for us as a program that as funds are dwindling, that the communities are empowered to be able to take up this as their personal, and also be able to empower them financially to take up these actions in the community.
For the US PEPFAR, beyond the Global Fund resources, we collaborate in ensuring that gender equality is advanced in Nigeria. We're very particular in ensuring that the adolescent girls and young women and adolescent boys and young men are included in all the initiatives and strategies that we promote in Nigeria. Be it in health, be it around women empowerment, be it security, humanitarian services. We ensure that these people are at the forefront of ensuring that these plans are even implemented rightly. In fact, when we are designing the interventions, we bring them to the table. We ensure that young people and adolescent girls, young women and boys are actually at the planning stage, and even at the implementation stage at the community, we ensure that they are there. And then we have this initiative that is community-led monitoring, where young people can be the drivers of ensuring that these initiatives are implemented the way they want it to go. And also they are part of the monitoring processes, and we get feedback from them, which are included in our country operational plan that we design, which runs on a yearly basis. And now we have it actually for 2 years.
What the Ministry of Youth Development is doing, and one of our mandates, is to basically drive to improve and to innovate for young people to be part of the economy. And our part in it is to ensure that we have policies in place, we create an enabling environment, and we also create programs that support that initiative. So the Gender Equity Fund is just one of the programs that we're looking to work with, looking to partner with. The government is going to be able to track. There are very reputable implementation partners here that hosted us and invited us. So we're hoping to get, some of their frameworks and strategies on how they're planning to deploy and go to market. We can offer some technical resources, technical support in terms of scaling and reaching underserved communities. And in terms of how it is measured, it's going to be 1 year from now. The ministry can, decide that, we want to see how far this program has gone, and we're willing to also give our, resources to ensure that the program is a success. But we also want to have that continuous dialogue and engagement, and that's what we're really hoping for.
The meeting was very interactive as stakeholders present sought more insight to the implementation of the Gender Equality Fund 3-year project.